Margaret Wallis-Duffy, and welcome to part 2 of our 3-part series on hormonal health for women, brought to you by Rocky Mountain Analytical. My story is a rather long and involved one, and it started, a couple of decades ago, really. Hormones play a role in so much of our health, and little did I know that I was going to follow a family pattern and actually enter into menopause at a very young age. So I actually started having symptoms of menopause in my 30s, and didn't necessarily know that's what it was at the time, but with my medical history being quite interesting to say the least, when I talk to people about health and well-being and I talk about my personal wellness journey, when I say to them I've had 10 surgeries, 4 bowel obstructions, a lung collapse, and I've even had a fecal transplant because I had C. difficile, they're kind of taken back by that. How could you be going through all this? You don't look the part. And part of the reason is because I've really taken upon myself to want to make a difference in my own health and well-being, and hence share it with others. So when I started to enter into menopause, and literally abruptly, I had a 13-day migraine, and a very serious migraine where I was flat on my back and unable to function. And then they start to realize, yeah, you know what? Although you're young, yeah, your hormones are doing something really kind of crazy. I'd done a lot of work on my own. Diet, exercise, nutritional cleansing, meditation, really surrounding myself with the right stuff, but I wanted to take it to the next level. I reached out to see Dr. Christy Prowse, and knowing and respecting the importance of understanding conventional medicine, her being a gynecologist and obstetrician and a surgeon, but also being trained in integrative medicine, was really, really intriguing to me because I really felt like she could bring both sides of the equation together. So after looking at my results and showing them to me and explaining to me what she saw at the greater picture, which was really, really a pleasure to be sitting across from somebody who was saying, it's not all in your head, and here's why. But then also empowering me to be able to make more changes and supporting me and saying, bravo, you've done a lot on your own that's made a big difference in your health. So no matter what stage you're at in your life, don't wait. Be an active participant in your own well-being. Get up, get going, surround yourself with the right team so that you can lead and live a vibrant life. Welcome back. Now, WOWTV is all about connecting and building an online community so you can have your voice heard. And with us here in the Social Media Hub is our WOWTV social guru, Paul Wright. Welcome, Paul.
Oh, thank you, Margaret. Glad to be here. And we'd like to thank everyone for engaging on hashtag WOWTV Health.
Thank you. So now, Dr. Prowse, we just saw my story, and menopause is very real to me at a young age. Can you speak to that to our audience? What is menopause? And let's talk a little bit about the symptoms.
Yeah. There is an important distinction to make between menopause or postmenopausal state and the perimenopausal time frame. By definition, you're postmenopausal or menopausal when you have been without a period for 12 months. Perimenopause, on the other hand, is the lead up to menopause, which for some women can be 10 years worth of symptoms. Hormonally, those are two very different states. Typically, most women in their 40s are experiencing something called estrogen dominance, where their estrogen levels relative to their progesterone levels, there's an imbalance there, estrogen being higher. That is largely, for most women, because we're no longer ovulating as reliably as we once upon a time did when we were younger. And we rely on that ovulation to balance out our estrogen in the latter half of our menstrual cycle. So when women are estrogen dominant, that's where we tend to see women experiencing heavy periods, more painful periods, PMS symptoms, all those sorts of things that, of course, are very disruptive to a lifestyle. Whereas in the postmenopausal time frame, typically many of those women have both low estrogen and progesterone levels. and the symptom profile can shift from what we were seeing before to a slightly different pattern, where we see that there can be a change in moods.
Yep.
There can be impact on sleep, right? There's the hot flashes that we typically talk about.
Yeah,
right?
absolutely.
Yeah, absolutely.
Yep.
Yeah, for sure. Vaginal dryness, and often what accompanies that is the painful intercourse. Right? And so really there's a whole constellation of symptoms that distinguish between the two. And very important to figure out exactly what's going on in the individual so that you can tailor treatments accordingly.
Now, one of the things when I sat across from you, I'm a real visual person, and you have what's called the healing pyramid, and it was a visual representation to me that made sense. Can you speak to that now?
Yeah, there is a definite order in which you want to heal hormones. And when we've just been talking about estrogen and progesterone, which of course are typically the hormones that we associate with the perimenopause and menopausal time frame, but they don't operate in isolation. And really what happens often is that there is more fundamental hormonal imbalances and system imbalances that are only aggravating anything that's happening with estrogen, progesterone, testosterone. And so when you heal hormones, there's a definite order in which you want to do so. And by doing so, you're helping to heal the layer above, which heals the layer above, right? So by the time you get to a layer, you may not need to do anything at all. And if you do, probably less of it, right? And so you can see on that pyramid, the bottom of that, gastrointestinal tract, which we're going to talk about in the next show.
Yes.
But also the follow-on, you see estrogen, progesterone is quite high up the pyramid. So by correcting everything beneath it, you're going to have less to do at those upper levels.
That's right. And it is so important to have that explanation. And I think the women at home and here in our audience will agree that having that visual and hearing that and understanding it on a real fundamental level empowers us so that we can have those conversations with our physicians and integrative health professionals across the country. Correct?
Correct.
Yeah. So if all of you would like to take a look at the healing pyramid, you can go to WOWTV, and we will have that there for you to take a look at. And if you're looking for a practitioner in your community, you can go to the Rocky Mountain Analytical website and search for a practitioner in your area so that you can too get the help that you need. So now Dr. Prowse has a wonderful patient named Gina who is courageously willing to share her story. Let's listen to her story now. I think you'll find it very interesting.
I think the best way to describe it is if you can think of that mid-afternoon slump. That's how I felt all the time. And I have felt that way sort of since puberty began. So as that change of life was occurring, it was just getting worse and worse and worse. The brain fog, the fatigue, the mood swings, they were all becoming very challenging. I would have mornings I would try to get into the office and it would be like pushing myself through concrete. It was very challenging, to say the least. I have looked for solutions. I knew it was hormonally based. When I hit 40, I sort of thought, I think I better do something or I'm going to be in big trouble as menopause approaches. And so I did seek out the naturopath at 40, started to peel the onion a little bit, but I still wasn't getting that vitality that I'd watch other people have. And they would have these full lives, and my life was starting to just get smaller and smaller, the things that I couldn't do anymore. It was extremely frustrating, but that's where I was. So a year and a half ago, when I first found the hormone clinic, I was almost at the point where I had to consider disability. I was literally that sadly off. So I finally came in for my results. Again, took a little patience, but things were good. I was down to a 4-day week by then, so I really was looking for some hope. It was really interesting because I got to see where I was. It was like somebody finally had some concrete answers. I could see where all the levels were, and Dr. Prowse just sort of looked at them all and said, okay, I think I know exactly what we want to do. We have to be very careful because we don't want you to feel worse. And I was thinking, I'm not sure you could make me feel worse, but that works for me. Just tell me what it is. So got set up, started the IVs, and within the third IV, it was like somebody had woken me up. It was the most incredible feeling. My family didn't know who I was anymore because I literally had energy. I have the flux and flows of any hormonal changes. They have been fabulous for monitoring. They've been great for just sort of pitch hitting of what you need. The response is always phenomenal. I just feel really well taken care of. I still get tired, but I don't get fatigued. And there's a really important distinction in between those two words. What they did for me was to remove all the food cravings. When you have low adrenals, out of whack hormones, you're always searching for the sugars, for the fats, for the alcohol, for the salts, you name it, anything that's going to keep you pushing forward to do the things you want to do in your life. And it went off like a light switch. And I dropped 20 pounds without even batting. And I didn't have to work at it. It just sort of fell off. And I didn't even think that was possible. So, and stayed off. So a year and a half, I haven't had to fight that. It just moves on, and I am so grateful.
Hi, I'm Fina Scropo. I'm the author of the Healthy Italian Cookbook. We're here at Lady York today trying to fill our pantry with some great items for our hormonal health. Now, the first thing we're going to talk about is protein. You might think that protein only comes from eggs and meat. In fact, there's a great amount of protein that comes from the pantry. So, things like, we've got nut butters, wonderful sources, I can't get enough of them. We've got lentils, we've got some chickpeas, we have some Romano beans. They come either in a dried variety or in a canned variety. And so why do we need protein? Of course, protein helps us build everything from our hair and our skin, enzymes, and our hormones. Very important for that. It provides us with something called tryptophan that you can only get from having protein in your body. And tryptophan is a building block for the brain chemical serotonin. And as we know, serotonin is important. It's a mood booster. It helps us with symptoms like PMS and hot flashes. And so it's important to have in our diet. As well, I love protein. Of course, it's easy to incorporate legumes and beans in salads in the summertime, in our stews, in my pasta, for example, when I make my cannellini and bean pasta. So don't discount protein that you can get in the pantry because there's a multitude of it in here.
Now, we do have a live studio audience here tonight, and I think it would be wonderful to head out to them and ask some real women some questions. I understand Trudy in the audience has a question. Could you share that with us, Trudy?
Yes. Is hair loss post-menopause, they're talking about hair on the head loss, normal?
Dr. Prowse.
Yeah, hair loss is a major complaint of many, many women in the perimenopausal time frame as well as in the postmenopausal time frame. It really isn't just isolated to the estrogen and progesterone that we've been talking about. There are many hormones that can contribute to hair loss and the consequences of disruption and imbalance in other systems like the gastrointestinal tract. So when you're exploring hair loss, you've got to, for sure, target it from multiple angles. So whether you're talking about cortisol being a problem or estrogen, progesterone, testosterone being an issue. One of the smaller breakdown products of testosterone is a little hormone called dihydrotestosterone. It works at the level of the skin and the hair. That can be an issue resulting in hair loss. Thyroid issues, of course, can be, but also nutrient deficiencies. There are many factors that go into hair loss, and it really should be investigated from all of those angles so that when you go to heal it, you can get out all angles.
Thank you. So I am going to actually pose a question that I'm sure many women wonder, are often frightened to ask, maybe embarrassed to ask, but I'm going to boldly ask about libido. Yes. And how is your libido and sex drive impacted when you're in perimenopause or menopause?
Yeah, absolutely, and that's another major concern of a lot of women. And once again, yes, very common in the perimenopausal and postmenopausal time frame, but in fact isn't always related to the hormones that we do experience as part of the aging process. Typically, we associate with decreased sex drive with the hormone testosterone, and yes, both men and women do have testosterone, just in varying amounts, but in actual fact, much of the time, it really isn't a testosterone issue, and in fact, a lot of times it is the hormone cortisol, which is our stress hormone, that causes us to have decreased libido. So once again, that's a question that you have to approach from multiple angles to get at what the real root cause of the problem is, and treat it accordingly.
Okay. Now, because I'm sure many of the women in the studio audience, and myself included, I'm a high energy kind of gal. And you talked about it in show 1 in your story, and how, you know, you could always push through. You know, you just keep pushing through. Gina made reference to it in her story. Yeah. The feeling of anxiety and maybe depression, how is that all impacted when it comes to our hormones?
Oh, absolutely. That personality and that characteristic you're describing of pushing through things is a very common thing that a lot of people will do, and it's actually part of the problem, is that you keep pushing and pushing and pushing, failing to recognize the impact that that's having on you physiologically. The fallout of that is a disruption in cortisol, which we spoke about in the first show, and then the consequences of that disruption to cortisol. And if you impact on the gastrointestinal tract, then you're going to run into difficulties absorbing and breaking down proteins and amino acids. And those are really the building blocks that we use for many, many, many things in our body, including our neurotransmitters, which are our brain hormones, the ones that keep us happy, keep us mellow, keep our impulses in check. Those are often...
Keep our impulses in check. I like the way she says that.
Yes.
In my house, it was the crazy woman spinning her head around and yelling at the children, or snapping at your husband. Right. I mean, I'm not poking fun at this, but it's real.
It is very real.
Yeah,
it is very
real. It's really something that we need to have a conversation about. Paul, speaking of conversations, lots going on out in the social media world. Please let women know how they can continue the conversation.
Absolutely. Please use the hashtag WOWTV Health, and you can also catch the on-demand rebroadcasts in case you missed one of the episodes on wowliving.tv.
And of course, we've got to be doing a big shout out to our good friend Todd Miller and Listen Up Talk Radio.
Listen Up Talk Radio is talk-radio.ca. They're kindly rebroadcasting this on the radio, and we're going to have an after show after show 1, so we're looking forward to everything.
Right, fantastic. Well, we are going to come back to you in the panel very shortly. But right now, we're going to throw to a tape. A couple of weeks ago, I got to sit back and interview Dr. George Gilson from Rocky Mountain Analytical to listen to his view on hormones and a holistic approach. Check this out.
So once we have the results from this testing, what can we do and extrapolate from that in terms of helping to set out a treatment plan?
Well, in some cases, it's pretty straightforward. If you've got somebody that's got some classic symptoms that they've got too much estrogen, and you do a test by whatever method you choose, and the estrogen levels are high, then that confirms your suspicion. But what if their estrogen's normal, right? Then it introduces the concept that, well, it's some other hormone that's balancing that, in this case progesterone. You can have normal estrogen, but your progesterone's too low. So it's important to measure more than just one hormone, and sometimes you got to look at the balance and see it's the balance, not the absolute level of estrogen's high, or this fellow doesn't have enough testosterone, for example. So things like that. It can be an overt excess or deficiency, but sometimes it's more tricky, and that's where you have to do your homework. It's like, okay, it's the balance, or the genes are amazing. They weigh all this information like analog computers.
This discussion is fantastic because really the mandate of this series is to try to help inspire and educate women so they can make some wise choices about their own health and the path that they want to take for their own well-being.
And no woman, man, woman, child, whatever, no one should be afraid to go to their doctor and be talked down to, or feel like they can't bring these things up. And a truly humble physician is gonna if they don't know, maybe some of the things that their patient knows, they shouldn't, dismiss that, or they should say, okay, well, here's an opportunity for me to be educated, which is, the way a lot of us got into this is we just got curious, and our patients taught us how to heal. And so a good doc should welcome that from their patients. So if this helps to educate some women to get out, and the system's never going to change unless the consumers go in there and say, I'm not satisfied with this answer that I'm getting old. You just have to put up with it. So it's never going to change unless empowered people go in there and say, I'm not settling for this. There's something more. I know it. So help me find it.
Thank you, Dr. Gilson. Now, WOWTV loves to reach out, and it's really important to be giving access across the country for women, and there are some great resources across Canada. Right now, we have a very special guest coming to us all the way from British Columbia. Her name is Dr. Sharon Gurm from the Port Moody Integrative Medicine and Cancer Care Clinic. Welcome, Dr. Gurm.
Thanks for having me.
I understand that you do a lot with cancer patients, but you also do a lot with hormones. Could you speak to supplements and how we're talking about menopause and how that can impact and educate women about those supplements that they can get over the counter?
Sure. I think in this day and age, there is an overabundance of consumer products available over the counter to address things like menopause or premenstrual symptoms. And because it's so prevalent in the population right now that so many women are dealing with these types of hormone-related conditions, there's the urge to purchase those types of products. But, I think it's really important that women resist the urge to self-prescribe, because it's a good idea to get expert advice and expert guidance. A woman might unknowingly be purchasing a product that might be right for her, might not be right for her. And if it's not right for her, you can actually do more harm than good. So it's important for women to know that just because a product is natural, it doesn't necessarily mean that it's safe, or that, more importantly, that it's right for her.
That's so important, and we've been talking about that a lot, Dr. Gurm, on this series, is that there's not a one-stop solution for every woman, and I thank you for recognizing that and for sharing with us. We're so thrilled to have you coming all the way from out west, and I also understand that in British Columbia, naturopathic doctors can actually prescribe. Is that correct?
That's right. So we're very fortunate in BC in that naturopathic physicians can prescribe pharmaceuticals. And so in that category exists bioidentical hormones. So we can prescribe bioidentical hormones if the naturopathic doctor has acquired their prescribing license. So that's a real advantage for us here. And, I don't prescribe bioidentical hormones for every one of my patients. I think it's important that we be conservative in that approach and make sure that the women who need bioidentical hormones are the ones that are getting them. So not every woman, I believe, is a good candidate for bioidentical hormone therapy. And so it's important that we evaluate each woman as an individual and use lab values, lab data when it's appropriate. And I use a lot of saliva testing in my practice because I think it's a really good way to perform the assessments for estrogen and progesterone and cortisol and DHEA, testosterone levels. So with that data, we need to interpret that in tandem with the patient's clinical symptoms and then decide what the best course of action is so that we can effectively restore the hormones. And that might involve bioidentical hormone therapy and it might not. But even if we use bioidentical hormone therapy, I think it's really important that there be a focus on some of the foundational elements of health. So we can't get away from the important aspects of nutrition and addressing a woman's lifestyle behaviors and habits and making sure that we're really looking at all of those things collectively to optimize health in the best way that we can.
Thank you so much. We really appreciate you taking time out of your practice to share with us today. Be well, and would you come back on WOWTV again?
Absolutely. I'd love to come back. Thanks for having me.
Thank you. Enjoy the rest of your day out in BC.
When we think about exercise, the primary benefit that we think about is changing or restructuring our body composition. But there's so much more, there's so many more benefits that can come from exercise. Exercise improves bone health. It's an incredible stress reliever. Exercise helps us to sleep. When we exercise, we release all sorts of chemicals, endorphins being one of them, which can also assist with balancing out hormones. Exercise helps us to improve our libido. It makes us feel good. It improves self-esteem and increases self-confidence. It's really so much more than just changing our body composition. Well, one of the first things that we do is establish what are our clients' goals. And alongside that, what is extremely important is discovering from each client what are their values in life. So we know that we are driven and motivated by what we're passionate about. You and I are the same. We do the things, we do what we love because we're motivated by what's important to us. And so in the start out with clients, I want to know what their goals are, but I also want to know what is important to them in the context of their life. And then it's really about creating a bridge or a link between exercise and those values. If we don't make that link, if we can't really understand the true reason why we're exercising, then we're not going to feel motivated. It's more than getting into a bikini. It's about achieving the fitness and health goals we want so we can show up in life and be who that we want to be.
Welcome back. And that was Michelle from Aura. And now I've got more women on my panel. Michelle, founder of Aura and a transformation specialist. Welcome.
Thank you. Thanks for having me.
And Ashna Starrett, who is a holistic health practitioner and has a doctorate in holistic medicine. Welcome, Ashna.
Thank you.
So before we get started on our girl chat here, I got to go over to the social media hub because we've got a really cool contest for all of you at home. Paul.
We do, Margaret. We actually have a little bit of work for our cyber audience. We need them to go to the Rocky Mountain Analytical website, which is rmalab.com, and you're going to find a symptom search button there. You're going to type in depression and be one of the first to tweet us the first test that comes up, and you're going to have a chance to win a $50 Spa Finder gift card and a 1-year subscription to Live Happy magazine. So you'll, as you tweet on WOWTV Health, make sure you use the hashtag WOWTV Health, you'll be entered in the random draw.
Thank you, Paul.
No problem.
Get busy. So, when we're talking about exercise and menopause, Michelle, can you first speak to how here at Aura and women across the country, how do you inspire them to, when they're feeling sluggish, like we've heard through this entire show, how do they get started?
You know, the first thing I like to do with women when they're going through menopause is to first of all let them know that it's okay. A lot of times women feel very much on their own with the symptoms that they're going through, and so I want to make sure that they know that they're not alone, and that exercise is a really powerful way that they can take control of what it is that they're experiencing and participate in the healing process as they go through menopause. And exercise has so many benefits, but what's so fabulous about it when we're going through menopause is that it helps with things like hot flashes, it helps with sleeplessness, it helps to improve our libido, it helps with that brain fog. I mean, I know that when I exercise, it just improves my mental clarity straight away, and it's just a very powerful way to take control of your health.
And they can start slow. It does
Absolutely.
seem like a daunting task. And
Yes.
one of the things I love about what you do is that you help to coach and empower and inspire and be a cheerleader so that they can actually feel that they can do it.
Absolutely. I mean, it's important that clients are doing what they love and embracing an exercise regime that they're excited about. I think that's really important.
It is. Now, Ashna, from your perspective, what can you add to this conversation?
When a patient is going through menopausal symptoms, it can mean that they're intolerant to their hormones, something like progesterone or estrogen. If they're intolerant to that hormone, their body can't recognize it and they can't utilize or produce it efficiently. So using the bioenergetic therapy method, we can rebalance that. Their body now recognizes it, they can utilize it much more effectively.
Mm-hmm. Now, Dr. Prowse, whether it's at the Institute for Hormonal Health or whether the other integrative medical specialists across the country, when we're looking at menopause, I mean, we've just touched the surface here today. What is the importance of this whole mind-body connection?
Oh, it's absolutely incredible. We've been spending a lot of time talking about the healing of the body aspect of it and the hormones, but of course, really where true healing often happens is in the mind-spirit aspect of it, and you really have to work on all three components to get the results that you're really looking for.
Yeah, you betcha. Thank you, the three of you, for being part of this series, and I know you're going to be sharing more in our next show, and I really do feel inspired and empowered, and I know that our audience will too. Thanks for joining us.
You're welcome.
So So ladies at home, this is the part 2 of our 3-part series, and we have yet one more series to come. Now remember, you can watch the first show by going to wowliving.tv. We want to hear from you. Follow hashtag WOWTVHealth and have your voice heard. It really matters to us to keep this conversation going. We'd like to give a huge shout out to Rocky Mountain Analytical and all of the other women and businesses that have helped make this happen. Until next time, be well, stay happy, and tune in.